Equity is an essential concept all teams must understand and apply throughout the brief and dialogue process. Judgments on the impacts of equity are extremely important. This can be done by examining the findings of a systematic review and considering the possible effects of an intervention on disadvantaged populations. Such populations may be distinguished by economic status, employment or occupation, education, place of residence, gender and ethnicity. Any option's potential impact on equity must be evaluated in relation to this list of factors associated with disadvantage.
I would say equity is trying to reach the unreachable. So the people in the system for whom the system works very easily, they don't have to make any extra effort. So they're able to access services, health system services, educational services, without making any extra effort. But then there are those groups that are not able to. So there are special groups like, I would say, people living below the poverty line, people in the rural areas, I would say prisoners, all sorts of people that for some reason they're not able to access the system as easily as they would have. So an equitable system would be one that is able to take care of those who are able to reach it without extra effort, but it is also able to reach the special groups. I would call that equity.
Equity is so theoretical for many people. Personally, I prefer addressing inequalities. What we've tried to do in many of our policy briefs to ask ourselves, are there any groups outside there excluded from the access to a specific or a particular service? When selecting option, will we create or reinforce any existing or pre-existing inequalities in access to services? Looking both on the user and the provider side. One big concern in Cameroon is around the inequalities in the access to healthcare services between the urban and the rural area. And we've tried always to address this.
It's necessary to be able to understand how an intervention is not only effective to do what it's supposed to do, but to help reduce social inequities.